Thank you, Chair Murray and Ranking Member Marshall, and I want to thank all of our witnesses for being here today. We know that the end of Roe is not the final goal of anti-choice extremists. Their ultimate objective is to ban abortion nationwide. We have to hold the line against any efforts to enact a nationwide abortion ban and keep fighting to protect a woman's fundamental freedom. This is, after all, about whether women are allowed to make their own complex life and health decisions. Dr. Brandy, in the wake of the Supreme Court's decision, we're hearing extremely concerning reports about women experiencing difficulty getting critical emergency care related to pregnancy. As Senator Murray mentioned in her opening statement, 1 in 50 women experience an ectopic pregnancy, a life-threatening condition. Doctor, can you walk through what an ectopic pregnancy is, how it develops, and how it is treated, please?
Absolutely, and thank you for the question. As you stated, ectopic pregnancy affects about 2% of all pregnancies. And an ectopic pregnancy is a pregnancy that is implanted outside of the uterus, most often in the fallopian tubes, but it can be in the ovaries, it can be in the abdomen. This condition will never continue on to a normal pregnancy, and often it is life-threatening for the person that has that condition. I'll tell a quick story that I had a patient recently in the ER with an ectopic pregnancy, and minutes are critical in the ability to take care of that person. I talked to them in the ER, they were walking around a couple of minutes, and then 20 minutes later, by the time we're in the operative room, they were critical. Their vitals were dropping. I had to emergently do their surgery in order to save their life, and I'm really glad that we were able to provide that care in such a quick fashion, but we've seen a chilling effect in other states. It was reported in the New England Journal of Medicine how providers in Texas after SB 8 were confused. They didn't know what was safe. They didn't know what was. They had to make decisions about whether or not to follow their oath or protect themselves against potential litigation and criminal action. And so it's really heartbreaking to consider as a physician that I would have to hold back what I know is evidence-based care to intervene right at that moment because I'm worried about calling my lawyer and making sure that I can do that before I intervene.
Right, and so as you point out, it is both the uncertainty created along with the reality that seconds count when you're caring for a patient with an ectopic pregnancy.
Exactly right.
Well, it is clearly, treatment for an ectopic pregnancy is clearly life-saving medical care, and politicians have no place in the doctor's office or in the operating room where a doctor should be able to provide care quickly and safely based on best medical guidance. One more question for you, Dr. Brandy. The Supreme Court's decision created countless legal questions that have brought uncertainty into hospitals and clinics, as you've just pointed out. Reports indicate that confusion has interfered with treatment for a number of conditions, ranging from rheumatoid arthritis and IUD insertions to miscarriages. Dr. Brandy, could you outline why this confusion is harmful in a medical setting?
Sure. We spend years and years of our lives as physicians training on the right management for the right condition, to be able to diagnose and intervene right at the minute that that patient needs that care. Medications are complicated and can treat multiple disease processes. For example, as you mentioned, methotrexate, which is a medication we use to treat ectopic pregnancies, and back in the day used to use for abortion care, also treat things like rheumatoid arthritis and lupus, which disproportionately impact women. And so there's confusion now between providers or pharmacists about what medications they can provide for patients. There's a lot of overlap, for example, in miscarriage management. It's the exact same medicines, the exact same procedure as abortion care.
Right.
And so it's unclear if providers can provide that care under these very confusing regulations.
Thank you very much, and thank you, Madam Chair. I think it's clear that these decisions are best left to women and their healthcare providers. Thank you.